let's talk about the sharps container. So the sharps container should be located in every operatory on some raised elevation, some counter space, easily accessible, stating, hey, here's the sharps container. So it should have the biohazard label, puncture-proof container. The lid should already be in place so that you can't take it apart. That is a safety feature so that the locking tabs are all engaged. So when you put this together, that way you can't go back after it. So make sure whatever you're throwing in here, you definitely want in here that you don't have to go back after it for. So what are some things that we throw into a sharps container? Well, following a procedure, we should gather up all of our sharps and immediately dispose them into our sharps container. Such items are carpioles, needles, blades, and yes, even the matrix bands. These are very sharp, and of course they're contaminated. They have blood and saliva residue on them. And if you've ever handled these before, you can get a pretty nasty cut out of them. So those should be disposed of into your sharps container. Now, once your sharps container reaches this full line, this is what you want to pay attention to. Once it reaches the full line, then we want to close this container off. We do not want to use this container anymore. I see a lot of people posting videos, pictures, and this sharps container is filled to the brim. You know, people are kind of stuffing it down, moving it around, shuffling it, trying to, play some kind of, like sharps Jenga out of it, okay? No. Once it's full, hits the line, most sharps containers, they actually have a lid you're going to detach. And then you can see these holes. You want to line that up and then push it down into place so that the locks are engaged. Then, once we do that, with the locks engaged, lid in place, I'll show you what we're going to do next. So with the lid on, engaged in locks, is an extra safety feature. I want to take some tape. Take some of this packing tape, wrap it around the lid, nice and tight. Then we're going to dispose of it. So let me show you how we do that. All right, so proper disposal. Remember, we have our puncture-proof container, lid on and locked into place. Taped is an extra safety feature. We're going to place it into the red bag. All right, the red bag should be inside a biohazard box. So what you want to do is you want to place that directly into the bag. Then, when the bag is full, or when your pickup is scheduled for, you want to make sure that you close that bag up, tie the bag, tape the box in place so that can be picked up. So, something to keep in mind about these red bags, you want to make sure that you're throwing away biohazardous, infectious waste only in there. The bags themselves, they get picked up, disposed of. They're very expensive. So dental staff needs to be aware of that because typically an office pays by the weight. So if you're throwing unnecessary waste that can go in regular trash in there, you're just adding to office cost. So I couldn't tell you how many times I've walked into an office, I see McDonald's bag right on top. That's a no-no. So make sure you read over what is going into this box to ensure that you are properly disposing of and also carefully disposing of. Because obviously, some people have the mindset of, well, this goes in there, and they might just try and throw a needle straight in there. No, make sure it goes into the puncture-proof safe. So if you have further questions about that, I'll do another video about strictly regarding the infectious waste biohazard bag. But today we wanted to get out there because I've been seeing more and more videos and people posting their sharps containers that are way too full. So definitely want to keep everyone safe. Definitely don't need any unnecessary needle sticks. So if you have questions, feel free to contact us. Comment on the video. Feel free to send us a message if you want to remain anonymous. And we will get back to you as soon as we can.